Pregnancy is such a beautiful thing, and a lot of women out there can't even wait to do the pregnancy test for them to receive the good news that they are pregnant. This video is prompted by one of my followers who wants to know the signs or the symptoms that she's going to see for her to know that she's pregnant. In this video, we are going to be talking about the signs, the symptoms that you're going to experience before you even miss your period, before you even go for that pregnancy test. Those things that you will feel in your body that will make you to know that you are actually pregnant. So please stay tuned. One thing with pregnancy is that it happens during your ovulation. So as a lady, you ovulate every month, and during this ovulation, what happens is that the egg is being released by the ovary. This ovary is the one holding the egg. The egg will be released on your ovulation day, and then the sperm cell of your partner is going to fertilize this egg that is being released, and there you have it. The pregnancy journey begins. It takes about 6 days for the egg to travel from where it is being fertilized into the uterus, where it is going to implant, whereby the journey of pregnancy will begin. And when it gets to the uterus, it tends to attach itself to the wall of the uterus, which we call the endometrial lining. So this lining is going to receive this fertilized egg, and then the pregnancy begins to grow. Now, when the pregnancy begins to grow, that is after it must have attached itself to the wall of the endometrial lining, that is when you tend to have the pregnancy hormone will then be released. This pregnancy hormone, we call it HCH, human chorionic gonadotrophin hormone. So this hormone will be released, and then that is when you start having a lot of symptoms like morning sickness, like mood swings and all of that, and even increased urination. But before all of this happen, let's talk about the symptoms that will happen before all this. Mind you, there are some women that might not experience some of these symptoms, while there are some that will experience most of this. That is to tell you that fertilization process, the signs, the symptoms, or the way pregnancy occur from Mrs. A is different from the way it will occur in Mrs. B. In no significant order, we'll be talking about the signs or the symptoms that you're going to feel to know that you are actually pregnant. Back pain. So back pain happens when there is hormonal changes, and this tends to strain the muscles, especially around the back area, and that is when you tend to have back pain. Especially when you have back pain during your period, then you might be having back pain when you are pregnant. Like I said, it depends on the individual. So it is not every woman that it is compulsory for them to experience this back pain. Another one is bleeding. We call it implantation bleeding because this bleeding occurs after implantation must have been completed. This type of bleeding will usually come out during the time you are expecting your period, but the characteristics is different. Let's say you are the type that have 4 days period length. This type of bleeding is gonna take about 2 days, and even the color is different. It will be like pinkish in color or even brownish in color. That is to show that implantation has occurred. So that is why you might be having this type of bleeding. Headache. You might experience headache. This is because of the changes in the hormonal level is going to trigger headache, and then you experience headache. Mind you, you have to be very careful because during pregnancy, headache is not something you should keep quiet about. It is something you should talk about with your doctor or your gynecologist or even your midwife. Let them know if you're having headache. That is because headache can also be a sign of another condition in pregnancy. It can mean that your blood pressure is high. So if you're experiencing headache, please report to your midwife or your gynecologist. Another one is bloating. So you might experience bloating because of the hormonal changes. All of these things is happening because of the hormonal changes. So this one now is going to slow down the digestion rate. The way your food is being digested before you get pregnant will slow down, thereby making it to be possible for air to trap into your intestine, making you to be bloated. You might also experience mild cramp during the first week of your pregnancy. This one is actually different from the one you experience during your period. This is because the uterus is being irritated because of the implantation bleeding. Remember what I said, that after the implantation has occurred, there's going to be a bleeding, like a light spotting that is going to come out. This bleeding is going to irritate the uterus, and the uterus is going to contract because of this, and that is why you are having mild cramp during the first week of your pregnancy. Breast tenderness is something that is common among most pregnant women because the breast become bigger, and then it becomes, very sensitive, and even sometimes you feel like it is sore. That is because of the hormonal changes in the body. Morning sickness, a lot of ladies experience this during their pregnancy due to the changes in the hormone, the changes in the level of the hormone in the body. Mind you, we call it morning sickness, but don't be deceived. Most people even experience this any time of the day. It's not necessary that you experience this in the morning. Morning sickness is also one of those signs that you experience during the first week of conception or even few days after conception. Visiting the loo or the toilet more often or not enough. Now, more often in the sense that because of the increased level of the hormones in your body, you tend to use the toilet to urinate more often. This could be a sign that you're pregnant. This might be one of the signs that you will experience during the first week of conception. Not enough. I talk about bloating, and I said bloating is going to make hair to trap in your intestine. Now, you might experience constipation. That is, you're unable to open your bowel the way you're supposed to. The most common one is missed period. Yes, if you're having a regular cycle and you missed your period, then it is worth taking a pregnancy test to be sure that you're not pregnant. But if you know that you're having irregular menstrual cycle, then it will be difficult for you to, guess that you're pregnant, because on a norm, your period is not coming the way it's meant to. So doing a pregnancy test will actually confirm this for you to know that you're pregnant or not. When you feel tired or exhausted for no reason, you're tired, you don't want to do anything, you just want to lie in bed, and maybe you've experienced or you are experiencing one or two of the symptoms that I have listed, you might want to take a pregnancy test to be sure that you are not pregnant, because this might also be a sign that you are pregnant. Another one is some women believe that when they are pregnant, they have some funny taste in their taste bud. Maybe like taste of metal or some funny taste at all. Some people believe that when they have this type of taste, then they know that they are pregnant, while some people tend to dislike a lot of things that they love. I know this might be later during the stage of pregnancy, maybe in the first trimester, but not necessarily the first week of pregnancy. This might be a sign that you're pregnant as well. Most of these symptoms, most of these signs that I have listed are those things that you even experience during your ovulation and even during your period. That is to tell you that all these changes are due to the release of some hormones in the body, like the progesterone. So these hormones are the one causing all these symptoms, all these things you're feeling in your body. Mind you, the only way you can confirm your pregnancy is to do pregnancy test. Like I said, after implantation, the pregnancy hormone is going to be released. This hormone, like I said, is HCG. So this human chorionic gonadotrophin hormone will be released, and that is when you come out with a positive pregnancy test. And voila, there you are with pregnancy. And you're celebrating and happy and all of that. Mind you, if you don't experience any of these symptoms that I have listed, that doesn't mean that you are not pregnant. You might be pregnant but not experiencing the symptoms. Like I said, it varies from one woman to another, so you might not experience these symptoms, or you might even experience some but not all of it. When should you do pregnancy test? I would advise you do a pregnancy test when you notice that you missed your period for about 4 to 5 days, or like you've been having these symptoms. You should check, to be sure that you're not pregnant, and make sure you check the package of the test strip. Check that the test strip is in date, and if you have a positive result, congratulations, and this is the time you should visit your gynecologist or your midwife or even your GP to let them know that you're pregnant. and you'll get the due vitamins, the due supplements you're supposed to be taking during pregnancy, and also get checked to be sure everything is fine with you and your baby, and you both are safe. So this is why you need to, visit your gynecologist and your midwife to be on a safer side. And I hope this video has helped. If you enjoyed this video, please like the video, share the video. Let me know in the comment section the signs or the symptoms you experienced during your first week of pregnancy. Please let me know in the comment section. I really want to read from you. I also want to learn from you as well. And thank you for watching today's video. Don't forget to share, don't forget to subscribe, guys. Thank you so much. I can't appreciate you guys enough. Thank you so much, and I will see you in my next video. Bye.